Hi, my name is Suzanne and I'm a massage therapist here at State of Grace, and I'm going to show you something that I do with many of my clients because so many people come in with the tight traps, oftentimes from sitting in front of a computer. So this particular stretch is a stretch that is created between myself and the client. And what I love about this stretch is the client is in control of how much they want to experience this stretch based on how much they rotate their head and how much they drop their chin to their shoulder. And so the way I do it is you need to have some sort of cloth. You don't want to do it on the bare skin. I start by just warming up the muscle a little bit, warming up the tissue. And I start by asking you to sit up nice and straight. You want to look straight ahead. Now, I'm going to pin the muscle, Ashley, and what I'm going to ask you to do is I'm going to ask you to slowly rotate your head to the left and then drop your chin to your shoulder. So, not yet, not yet. So it's two separate moves. You don't want to do the moves at the same time. Okay, and it's really good to go slow. The slower you go, actually, the more effective it'll be. If you go too fast, you just risk injury. So I'm pinning the muscle, and I'm going to ask you to slowly rotate your head to the left. You can rotate it as far as you want or as far as you can, and then slowly drop your chin to your shoulder, not raising your shoulder up to your chin, but dropping your chin to your shoulder. And you can see how you're in control of how much of this stretch you want to experience based on how much you rotate and how much you drop your chin, yes? Mm-hmm. Can you feel that?
Yes.
Yeah. And so then when you're ready, you can hold it for a little bit, and when you're ready to come up out of the stretch, you want to raise your chin up and then rotate your head back to a neutral position. Two separate moves. And you'll find that usually the pinning closest to the neck is usually the more intense stretch. It's one of those stretches, if you've ever heard the term, it hurts so good. So I'll move down and do it again. Now the other thing I tell my clients is that if you want to try this at home, you really want to make sure that because you have to do it with somebody, you want to make sure that whoever's doing it knows what they're doing, because if you are too forward on the muscle, there's the brachial plexus nerve, I believe, and of course arteries, and if you're pinching that, then you're risking passing out. And if you've ever seen on Star Trek that Spock move, that's basically what that concept is. So I'm sliding down, and again, slowly rotating your head. And then dropping your chin. And I can often feel how you're feeling it because the muscle wants to pull out of my fingers. Are you feeling that?
Yes.
Then whenever you're ready, you could stay there forever, right? And then that last muscle, the last muscle is usually the less intense one, although some people can still really feel a lot of it. But we just move over and we do it the last time on that little itty bitty piece that's almost to the shoulder bone. Go ahead. I can tell you're feeling it because it wants to pull out of my hand. Are you still feeling it?
Yes.
Yeah. Is this that one of those hurt so good stretches?
That feels good.
You hate to love it. But it is effective.